First one up would be the Health Department. Jack on?
I am here.
Hey, Jack, how are you?
All right, just waiting for the resolutions to roll up. Okay. Alan Topal, who's a veterinarian locally, is a member of our Board of Health. His term is up. He does wish to continue for another 6 years, and that requires a board resolution, so that's what this is.
Any questions?
I'll move it, Morel.
Second?
Patsy.
All in favor?
Aye.
Opposed? Carried.
Many of you already may have heard Ed Coons, who's been with us for 33 years, is retiring effective July 17th. And this is a resolution to fill his position. I am lucky to have two very qualified people within the department who can fill his shoes. And so it is to fill his position and any backfills that result from moving those folks up.
And can I ask you who it is? I mean, Jack, can I ask you what it is?
Actually, I haven't nailed it down yet.
I know you got some good people. I think I know who two you're talking about. Yeah, but.
You'd be surprised.
Oh, I am? Oh, good.
You'll be surprised.
Well, we're gonna be said.
One of the ones you know about it, actually, you think you know about it, doesn't really want to do it. So.
Oh, okay.
I do have two folks. I'm narrowing it down.
All right. But Ed is going to be missed.
Yes, very much so.
I'll move it, Morel.
Second?
Second. Mushman.
Mossman, all in favor?
Aye.
Aye. Opposed? So carried.
So he's going to be missed, but only for a short period of time. We have a sanitarian, a part-time sanitarian that was helping manage the SIDWIS program, which is the federal water program. She's decided to re-retire. She was our director in the past, and decided to re-retire back in April. We have kind of closed ranks, and she helped us set up that SIDWIS system, and we don't really need another person to do that. So because of the new project, the DEC project down in Copac Lake, Robinson Pond area for new septic systems down there, and also the explosion of, pardon the pun, of septic system. There's people who coming up from the city who want to build up here and whatever. I would like to employ Ed at a sanitarian salary through October.
I'll move that.
Second?
I'll second Sterling.
All in favor?
Aye.
Aye. Opposed? So carried.
And finally, we have the Healthy Neighborhoods program, which requires, we had two technicians doing that. They go to people's homes, they look for safety stuff, smoke detectors, fire alarms, clutter, sanitary situations or whatever. Haven't been able to do it because of the COVID, closed us down. Back when COVID started all of this for us and the county shut down and we froze positions, we were on the verge of hiring a person to do this work. And we froze that position. We didn't fill it. Now the state is giving us the green light to move ahead and start to do that work again. And so this is a budgeted position, and it's pre-existing position. Just want to fill it and get that program going. The way it works is that we bill for expenses under the grant. So it's not no money coming out of the county. It's just if we don't, it's money that is there for us. So we want to open it back up to the two full people there.
The position is 100% funded is what I read.
Yes, it is.
I'll move
that. I'll second it.
All in
Brenda, you
favor?
can move it. I'll second it.
Okay, got it.
All in favor?
Aye.
Opposed? So carried.
I believe that's all I have. And as far as resolutions, anybody has any questions on the monthly report or any other thing related to COVID and whatever, I'd be glad to answer.
Not sure everybody knows, but the governor lifted all restrictions today. Did you see that? We're at 70%.
Except for those that apply to schools.
Right. There's several that it applies to, but
Schools and nursing homes and
jails.
jails.
But that means summer camp can go with no masks, no health screening, right? Summer camp isn't in the school category.
Right? He didn't mention it, so I think that it does mean that we can move forward on it.
It was specifically identified, Jack, as being, being lifted.
Okay.
And it does say that unvaccinated still have to wear masks and retain 6 foot distance, but I'm not sure how that would be, monitored and or enforced, but that's where we're at, so.
But aren't the
Chairman,
CDC, I'm sorry.
No, I just sorry to interrupt. Jack, Bob Gibson here. Just hoping, does that make, and I don't think it does, but does it make one of my resolution requests moot to help you get a quarantine place, or do you still want to keep a quarantine place for the foreseeable future?
We have not, we're still doing contact tracing. We're still tracking our positives. So no, we're going to need a quarantine house for the near future.
Oh, okay. Okay. So if you could just stick around till we get to that proposed resolution, I'd appreciate it.
Okay.
Brenda, did you have a question?
I did, thank you. So Jack, just for clarification, aren't the CDC guidelines that you have an either or? You can choose as a municipality to mask and social distance, or you can unmask for people who've been vaccinated when it comes to camps and meetings.
Well, I was in another meeting. I was unable to listen to the governor. It sounds like other people on the call, Matt in particular, mentioned it. I'm not exactly sure what he's done there, but I did hear from Questar that, for instance, at graduations, they expect that unvaccinated people wear a mask until they're seated. That was one thing that was mentioned to me by somebody from Questar. So, Matt, can you answer that question?
Not that one specifically. I will say, in talking to Rob Fitzsimmons today about this, there were a lot of headlines and categories that they mentioned as being released from having, to social distance or wear masks. But as Rob pointed out, there's no guidance as of yet. So they expect guidance to come out shortly.
Okay.
Because it did also say that businesses could still require that unvaccinated individuals wear masks. Again, I think very difficult to enforce any of this at this point, but it doesn't mean that it's not out there. So we'll see what guidance comes out. But I think the problem is once you see those headlines, everybody is just done. So I was in Albany today at several different places and nobody had masks on. I mean, I don't care where I went, waiting online. It was just, seems like everybody's just, for the most part anyway. So anyway.
Well, just so everyone's aware that there are going to be 16 locations across the state where the state is doing fireworks to celebrate.
Right. Exactly. So
Supervisor Holtling has her hand up.
Supervisor Holden?
You're on mute, Supervisor.
Thank you. I lowered my hand instead of unmuted. I realize we're still waiting for guidance, but it seems a little contraindicated to say all regulations are lifted, including summer camps, and then say, but if you're unvaccinated, you still have regulations, because most summer camps are ages that can't get vaccinated. So it seems to contradict itself, but we'll wait on the further guidance.
I mean, I think, as you know, Supervisor, there's been a lot of contradictory information that's been out there. So I think this is sort of following the path. Obviously, I think we all at this point have to use common sense and do what we think is appropriate. I mean, as Matt said, things are lifted. They're having fireworks celebrations. How are you going to tell somebody anything other than that at this point? So it's virtually impossible. Jessica, do you have a question?
I do. I'll be sure to get the guidelines out. I'm sure they'll come down within the next week or so, and I'll get them out to the municipalities. But I also just had a question because I had a meeting with the city of Hudson last week, and she's wondering, the new director there is wondering how to go about expecting, I mean, even though this has all been lifted, how do you go about expecting people who are not vaccinated to disclose that information? Does Jack have any idea how that can work across the municipalities that are running programs?
Well, what we've consistently heard from everybody from the CDC down to the state health department is you can always ask, but they don't have to tell you. And they can lie. And it's
Yeah.
completely on an honor system. And I think most people aren't even going to be bothering to ask because people can lie and people will lie. So they don't have to wear a mask.
And I'm assuming that the guidelines will still say that within the cohorts of the camp, is it still going to be a maximum of 36? Do we know? I didn't hear any of the information today, as of today. So I'm just wondering, or is it just going to be a free for all again at the sites? Do you know?
I don't know, except that what I did hear was that pretty much all of it was lifted. So I wouldn't be surprised if that 36 was lifted. But we'll just have to wait and see what comes out.
Okay.
I read something today, Jessica, that it was just large scale events, maybe like, concerts, et cetera. But I think from what I read briefly, all of those types of events were lifted. So.
Okay. Well, and I think that most of the municipalities have kind of gone through their planning process. So I think at this point, there probably won't be many changes. They became creative again and put a plan in place. So I think they might stick to whatever their plan is, but lift the wearing of the masks. But I think they'll probably keep the groups similar. And a lot of them have already ended registration because they capped off at a certain number this year because of the guidelines. So we'll see.
Dan Almasi has his hand up, and then Supervisor Adams.
Dan?
Yes, thank you. So I just want to check in light of this information and the fact that we're a healthcare provider. What I'd like to do with this group support is just continue the way we've been around the mask guidance that we received previously until we get more definitive guidance. I don't see a need to, kind of overreact at this point. I'd like, to ask our clients to continue to wear masks while they're on premises. I'd like to ask the staff to continue to wear masks in common areas, hallways, the kitchen, etc., until this guidance comes in. Does anybody see a problem with that?
Well, Matt hasn't changed the county policy at this point. So
Right.
That is the county policy.
Agreed. So I just, because I agree, like everybody's like, it's going to be a free for all. And I don't see why we can't maintain our current policy, especially in a healthcare facility like ours here. So that, our folks that are coming in increasing numbers for face-to-face visits have a multitude of comorbid disorders. So it's in their best interest to be masked, and for our staff that are traveling in the common areas like hallways and things like that to be masked. So until we get something solid other than this announcement, I'd like that permission.
Matt, we're going to have a discussion on this in reference to, and I'm assuming there'll be a new protocol or procedure that we'll put out through the county. Matt, you agree with that? Until then, I would say we should stick with what we have.
Well, even if we were to change it, I don't think anybody would
frozen.
it wouldn't prohibit Dan from continuing, the current policy based on what you just said, Dan.
Okay.
Can you say it again, Matt? You were frozen for a second.
I said, even if we were to change the policy, it wouldn't prohibit Dan from continuing the existing policy, at least for the time being.
Okay.
Okay. Thank you.
Anything else for Jack?
I have two quick questions. Jack, any update on whether or not we'll be getting any advertising out, billboards or otherwise? And do we have any plans to specifically market vaccinations to the 15 plus category?
We have 3 billboards up, two up in your neck of the woods.
Okay.
Chatham area, and one of them is on Route 9 in Stockport. It's pretty simple. If you need a vaccine, call then. It's the hotline number. We've done pods we've done vaccination pods for the schools, as you know, and for the 16 to 17 year olds and for the 12 to 15s. We're having one on Saturday for the 12 to 17s. Well, for everybody, pretty much. It's open to the public at Questar, and it's opened. We bring in J&J and we're bringing Pfizer. That's being advertised through the schools, targeted advertising through the schools. We don't have any more plans beyond that. I do think that as the summer wears on, and if possible, if Pfizer gets full authorization from the FDA, then we may see some mandates. That's possible for as far as the schools go. That's going to be interesting, and we'll be out there probably in August again. Hitting the kids again, trying to get any parents that have changed their mind and want to vaccinate.
Thank you.
Patsy?
Yeah, unfortunately, she's scrolling up, but I just saw that count, Jack, about Barnwell, 23. And I did have that man call me earlier today. Well, he emailed me. I'll call him tomorrow. About the cases at Barnwell, and that's till the end. That was at the end of May. It was said 23. Have you heard any more lately?
No, we haven't had any more deaths in any of the nursing homes, within the last, couple weeks. So it's quiet.
Is it quiet? All right.
Yep.
All right, there it is. See, there it is. Thank you.
All right. Thank you, Jack.
Okay.
Kevin?
Good afternoon, folks. How are we doing? Okay, my first resolution is to request authorization to contract with the Healthcare Consortium to provide services under the New York Connects program in an amount not to exceed $147,911 for a 12-month period to end on March 31st, it's supposed to be 2022. I'm sorry.
Any questions?
This is a standard contract. We've contracted with them at least 6 or 7 years for the same services.
I'll move it, Morel.
Patsy, second.
Aye. So carried.
Okay, second resolution is to request authorization to contract with a LLC called Care Manage for All. It's to provide caregiver support group with services to help take care of the seniors. Contract not to exceed $2,520. The money is budgeted, and this is supposed to be an innovative online program for people who are, to help taking care of seniors.
Any questions?
I'll move it, Sterling.
Second?
Adams?
Adams, all in favor?
Aye.
Aye.
Carried.
And the next resolution I'm very excited about. We received word from the state, from New York State Office for the Aging, that through the federal government's American Rescue Plan, we're going to receive funding in the amount of $267,690 to provide more assistance and services to seniors who reside in the county. This is like a windfall. We weren't expecting this. We're hoping to maybe resurrect our AIDS program, which I'm going to discuss a little bit later on. But like I said, this is money that we were not expecting, and hopefully it'll help the county out a lot also.
I move that.
Second?
Sterling.
Sterling, in favor? Aye, opposed?
Aye.
Carried.
Okay, and my next resolution is it's just a matter of switching money around. We back in March, we put some money that we got into a revenue account for the state, and it should have been put into a federal revenue account. I went through the controller's office to get this straightened out, so it's only a matter of $2,766.64. But like I said, it should have been put into a federal revenue account, not a state revenue account.
I'll move it, Morel.
I'll second.
Second, Adams, all in favor?
Aye.
Opposed? So carried.
Okay, my last resolution is to accept $17,501 in funding from the New York State Office for the Aging for the purposes of expanding access to COVID-19 vaccines for older adults. I've already talked to Jack Mayer from the Health Department, and we're going to use 15,000 of that to contract with him to schedule and administer vaccines. This goes back to, we can use anything from back to April 1 as far as getting reimbursed for this. And the remaining 2,500, our department's going to use to advertise these vaccines and to also provide transportation to vaccine sites. It's kind of like, we just want to keep the money in the county.
Abdus, you have a question?
I'll move the resolution.
Second? All in
Adam?
favor? Aye. Opposed?
Aye.
So carried.
Okay, that's it as far as the resolutions. And I know at the last meeting, we talked a little bit about personal care aides. And again, I don't want to take up a lot of everybody's time, but just to kind of give you a little bit of a background on where we're at with that. Back in 2019, that's when we recognized that there was a severe shortage of personal care aides, not only in the county, but statewide. We budgeted for the 2020 budget 3 part-time positions at a rate of $13,825, which is a grade 9. However, we put all of that on hold. It was put in the budget, and we put it all on hold due to COVID, and the hiring freeze. We just never pursued it. In this year's budget, the same 3 positions do appear, and our caseloads have really risen, especially through COVID. However, a lot of our cases are unable to get a home care aide into their homes. Right now, we got a wait list of 25 people. And, like I said, I'm just looking for some guidance as to, do you think, we should start looking at resurrecting this program, especially, and the reason I'm bringing it up now is that, especially now that we're getting that extra $267,000 from the American Rescue Plan, we could certainly use that to pay for this, even though it's already budgeted. But we could use that money to pay for this program. The money is good up through, I believe it's 2024. We have up until that point to spend it. And like I said, I'm just looking for some guidance as to, like I said, I would like to pursue it because it's very, I don't want to say heartbreaking, but it's sad to if we have people waiting for someone to put in their house for a couple hours a week to help them with just minor chores, and we have to say no to them because we can't find any. The companies that we contract with don't have any aides to put. Most of those aides, they're working the 8-hour shifts through through other programs, and like I said, this would go a long way to helping some of our seniors.
I mean, I don't see any reason.
We'd also like to, if we're going to pursue this, we talked about maybe purchasing a couple of vehicles so that these aides don't have to use their own vehicles. They could use county vehicles to get to their, if they're going to go to 3 or 4 places a day, like if they're driving from, say, like New Lebanon down to Chatham, they wouldn't have to be using their own vehicles. So just something to think about. And I was just looking, as I said, a little bit of guidance as to where we should go with this.
Supervisor Sterling?
Yeah, I definitely like this idea. I think we'll do much better. Sorry, I don't think this echoes me. I don't know. That definitely aides should be paid for their transportation time, because this is always a big problem. And if the cars help, that would be great. And I would like to start it right now. I mean, there's a lot of people out there needing help. And it keeps people out of the hospital. I think it's a big cost savings. The sooner we can do it, the better for me.
Supervisor Eldridge?
Kevin, you have staff that are willing to come and work for you now?
No, that's what I'm saying. We would have to hire these part-time aides. And again, I don't know, back then we were asking, and again, I'm not trying to rock the boat, but back then we were asking for 3 part-timers. But, I could certainly by now see the need for 4 of them, and maybe even up their pay a little bit, because I think everybody realizes how difficult it is to try to find people to go to work today. Like I said, if we give them a competitive hourly wage, that we could maybe recruit some people and do this. We would have to have, I'd also have to possibly upgrade one of our case manager positions to kind of oversee this, to do the scheduling and home visits. So, like I said, they have to be supervised, and I don't have anybody in a supervisory position right now that could do that. So, I mean, it would only be a matter of a couple $1,000s, I think, to upgrade somebody. But I mean, I certainly agree with Supervisor Sterling that this is something it's long been needed. We've been discussing this for over 2 years, and COVID just put us back with this. Like I said, that's where I'd like to spend some of this, I call it windfall money, that's coming down from the federal government. Like I said, and it's a service that's much needed all through the state, not only Columbia County. It's a statewide problem.
Supervisor Adams.
I wasn't done.
Oh, sorry, Kathy. Go ahead.
Okay. That's okay. Kevin, just to let you know, I have a question first. Are the home health aides that go into these homes, are they trained as home health aides, or are they CNAs that have been certified nursing assistants that have had to take the home health aide class? Do you know?
Yeah, they're not home health aides. They're personal care aides.
They're personal, so they still have to. There's still a training that they have to go to.
Yes, there is, and we're hoping to resurrect that through the college, through Columbia Green. They may have a training program, or one of the other places that we contract with. They're having classes all the time. This isn't like a CNA where they need hundreds of hours of training.
Yeah.
But yes, they have to get certified.
Because CNAs, in order to work in the home, I know have to be either PCA or HHA. They have to change their certification.
Right. Yeah, there's a
because
special.
I know that Questar had talked
program.
about offering the class at one point.
Yeah, because these folks are not allowed to administer medication or things like that. This is we have a level 1 and level 2. Level 1 is basic house chores to help them with, dishes, vacuuming, making beds, laundry, cooking, etc., like that. And level 2 is they may be assisting with showering and bathing and things of that nature, but there's no, it's not like a nursing program at all. It's kind of a program to help somebody over the rough spots so they can remain in their home safely.
Well, I'm all for it. So whenever you want to, that's fine with me.
Okay, like I said, we can start working on that and maybe prepare some resolutions for the next meeting. And if I'm certainly welcome to input from anybody on this. Because
Are you done? I'm sorry. Are you finished?
Kevin has to get muted.
Supervisor Adams.
Oh, thank you. I had a couple of questions. Is there an advantage to hiring part-time people over full-time people? Why would we employ 4 part-times as opposed to 2 full-times? Would the job be more competitive if it were full-time, or would it be harder to fill if it were full-time? Secondly, if they were county employees, could we be assured that they would travel to more remote areas, which the current vendors don't seem to be able to provide that guarantee or that service to more remote areas? And third, do the families that receive this care contribute in any way to the cost of the home health care aid?
Okay, to answer let me go your second question. That's why we wanted to do this, because a lot of the far to reach areas are not being served. That's why we wanted to do this with our own program, and that way we can and I know like New Lebanon is one of the areas, as is Canaan, down in Gallatin this way. This is the reason for that, and that's one of the reasons why we'd like to have county vehicles being used also. As far as the part-time versus full-time, I was doing this, I don't think there is any advantage. I was trying to do it the most budget cost-conscious way without, having to provide benefits and vacation and retirement and the whole bit. That was the reason I asked for part-times. And what was the last question you had?
Well, just the full-time question is if it's very hard to find people now, maybe to be a more competitive employer might make it easier to find people. And then my last question is, do the constituents, the people that are receiving the service, they contribute in any way financially?
Yes, there's a screening device that we use. It's like a sliding scale fee. A lot of them it would be free, and some of them it might be, $10 to $15 a visit or something. It's nothing really high. Like I said, it's a sliding scale fee that's used from a system that we get from the state.
So it'd be pretty universal.
Yes.
Thank you.
I would suggest, Kevin, that we pursue this and see how it goes. I mean, we may have to do, as you said, as you and I discussed previously, we may have to up the pay to get, people that are interested in doing this. We should at least get started right away. You could report back to us. It's very challenging to find people in general, so we shouldn't wait. We should get started on it and then report back and say we're getting no applicants, and then we'll, have to go through the budgeting process. But, it'd be better to get one person at a higher rate than nobody. So at least we have somebody. We need to talk about this for sure.
Okay, so
that works. Okay. Any other questions for Kevin?
Just real quickly, Chairman. Kevin, it's Bob Gibson. This all grew out of that committee we sat on that then Chairman Grattan put together. Isn't that so?
Kevin, you're muted. You got to unmute.
I'm sorry. I keep getting an echo. Yes, Commissioner, you're correct. That's the same committee. And as you know, we put out an RFP for that, and we got no responses. And this is where we ended up, that we'd probably have to hire our own if we wanted to be able to successfully administer a program like this. So you're correct. That is the same program.
That's what I thought, Kevin, and I know you were going to end up there. And I still remain committed. As you know, we have a lot of crossover clients, so I'll remain committed to that process too, and anything that we can put in place or any kind of MOU between us that can enhance this, I'm happy to come to the table on.
Thank you very much. It's much appreciated. So, Chairman, just so I get this straight now,
okay.
Do you want me to prepare some resolutions to fill these positions, or I don't want to advertise for them, unless
I would support that.
If I could just interject, Kevin, I think you need to have a conversation with our controller as well as HR director to see what positions are appropriate, because they probably they're going to have to fall in line with the union scale. So I would do that first.
Okay, I can do that. Thank you.
Yep.
So just out of curiosity, what do we do? I mean, if the bottling plant in Hudson is hiring people at $20 an hour to box bottles, and Stewart's is hiring at $17 an hour, how do we expect to find people to do this work? I mean, at
Well,
$13
I know that some of the places that we contract with, I don't know if you've ever heard of them, it's called Unlimited or Interim, Anytime. Those are the agencies that we contract with right now to supply personal care aids. And just for a quick note, we haven't had any of them accept any of our cases in over 2 months. But they're only paying their people I believe $13 an hour. We're hoping that if we could get up into the $18 range, that maybe we'll get some people, applying for this, especially if they're getting paid for traveling and have a county vehicle, because that's one of the big stumbling blocks that they have, is that these companies do not pay for that. So if if it takes them a half hour or 45 minutes to get from one point to another, they don't get paid for that. Whereas in our program, we would pay them for travel. So we're hopeful that we'd be able to recruit. If not, then I guess I'm in for a rude awakening. So.
I mean, I vote for $20 an hour. And what is that going to do to the union, Chairman?
Well, we just have to take a measured approach because
Kevin,
I'm getting feedback.
Honestly, it's very hard to hear. There's so much echo.
Yeah, Kevin, you got to mute. I think we just have to take a measured approach and look at it and see what the impact will be, Supervisor. I'm not saying we don't do it, but I'm just saying that we have to, because we have, as you know, a lot of union positions that work for the county, and if you upgrade one title, that could impact 10 to 15 people or more. So we just have to take a look at it.
And one more question. Can part-time people drive a county car?
Yes, we have part-timers driving county buses now, the OFA buses, the Department of Social Services cars. They drive clients as part-timers.
I have one more question for Kevin. Who applied for this grant?
You're muted, Kevin.
I want to echo. Nobody applied for this. It's just money that the federal government received through this American Rescue Plan, and they've funneled the money down to the state office for the aging. And then I don't know what kind of formula they used, but they did some kind of a formula to allot so much money for each county office for the aging. And Columbia County's share was $267,000 and $690.
Okay, thanks.
So the last time I forgive me for not knowing this. What's part-time? How many hours? What's the maximum number of hours for part-time for the county?
The 17 and a half for non-highway employees, and I believe it's 20 hours for highway.
That's per week?
Per week, yes.
Okay. Thank you.
I mean, one last comment. It would seem to maybe the towns could be the place where we recruit from. That it would offer some of the local folks an opportunity to have a job and near where they live, which could help cut down on some of the transportation issues. So maybe the town supervisors could help in the recruiting of these positions. Thanks, that's it.
Patsy?
Just a quick comment. I have to say, I believe the towns can help out. Everybody can help at this point when you're ready, Kevin. But my idea, if you're going from New Lebanon and you have to go down to Gallatin, I think paying for mileage is much more important. Or do they go from New Lebanon to Hudson to pick up a car and then the car goes to Gallatin? I mean, so even offering mileage would be a smart way to do it too.
You're correct, and that's what we would propose. That's exactly the same thing. And as far as Supervisor Musman, that's an excellent idea. I believe that some of these places that we contract with, they were going to attempt to do that. They were going to reach out, especially to some of the farther out towns, to see if there was anybody in their own neighborhood that would be interested in doing this. So I think that's an excellent idea to do that also.
All right, so Kevin, you're going to speak to Controller's office first and then get rolling with this, correct?
That's what we'll do.
All right.
Thank you very much.
Great, thank you. Dan?
Yes, good afternoon, everybody. Thank you. So let's see what you have in front of you. Should we do the overtime report, or we'll do this resolution? Okay. The resolution that you have in front of you is to backfill a vacant position. We have a behavioral health care coordinator, not to be confused with the behavioral health social work position. This position falls under our adult care coordination program. An individual has resigned, and their last day will be on the 30th. So we're just seeking permission to backfill the vacancy so that we can keep that program whole.
I'll move it, Morel.
Second?
Second, Mussman.
All in favor?
Aye.
Opposed? So carried.
Thank you very much. And so to the overtime report, you'll see that we are halfway through the year. We have really used a minimal amount of overtime. Original budgeted amount was $12,000. We've used $1,272.73, leaving us with $10,727.27.
Okay.
And in front of you, you have what's going to be now my bi-monthly director's report. I'll skim over this. Please stop me at any point if you have questions or would like more information. The first item up under the Director of Community Services is telemental health. I just wanted everybody to know that that continues to be renewed on a monthly basis. The most recent expiration date is coming up. It's tomorrow. We should be hearing from the governor's office as to whether or not that executive order that allows us to provide telephone-based therapy sessions and get reimbursement for those will be extended. I may have it in my inbox, but it's been a very hectic day, so I don't have that information for you, but it's likely going to be extended. It has been, and we're far from over with the pandemic. The next item is the meeting that I was invited to by Questar 3 BOCES and all 6 of the Columbia County superintendents. The spirit of that meeting was to hear from them as to how their student bodies were doing in the context of behavioral health, now that many of the schools are operating on-site learning. And they also wanted to hear from me as a department head as to where we stood here at the Department of Human Services in terms of how we could assist them, their student body, in addressing the behavioral health needs. So it was a very good conversation. There was some conversation about revisiting school satellites. One of the districts did express an interest about revisiting that. They understand that they would have to come to the table and help meet us in terms of finances. The previous ask that Michael Cole put out to all of the superintendents prior to the pandemic was that they cover 50% of the cost of a 7-hour day. At the time, that number was $400. So if in fact this superintendent is serious about this, I will have to reassess the numbers to see whether that $400 is still an appropriate amount. I will bring it here and discuss it with all of you in terms of, my department revisiting providing satellites to this particular district. I haven't heard any interest from the remaining 5 districts. Many of them did share with me that they've sought out hiring social workers and psychologists for their districts. That being said, I do believe there's still plenty of work to be done that we could offer them and help them with. Police reform panel update. I believe that's something that everybody is up to speed on. The report was submitted. There's a group being formulated in terms of how we can carry out and act upon some of those recommendations. So I think that's well underway. I want to draw your attention to the Community Services Board and the creation of the Local Services Plan. As all of you know, each year the CSB, the Community Services Board, generates a local services plan. So what we wanted to do differently this year, because to be honest, a lot of times the plan is created and it's not forgotten about. That wouldn't be entirely accurate, but it's created as kind of a procedural step. And the work is done in regard to the plan and the goals and objectives, but it's not necessarily referenced throughout the year in the way that it should be. So we wanted to keep things very simple, and you'll see that basically there are only 2 goals with a few objectives. We wanted to keep this really obtainable. That's not to say that a lot of other work with regard to initiatives surrounding behavioral health won't be going on. It certainly will be. It's not like we're just limiting our work to these 2 goals. Having to do with workforce and crisis. There will definitely be a lot of work going on in other areas, but as far as our local plan, we wanted to keep it very, very specific. And then hopefully you've all had a chance to review the report generated by, with the help of, I should say, Cheryl Roberts from the Greenberger Foundation, known as the Sequential Intercept Mapping Report, that has several recommendations in it. We're going to be having our special meeting in a few moments to discuss that in greater detail. But I'm very pleased that that report is complete and was able to be submitted for your consideration and review. In terms of the next item, this is something that Sheriff Bartlett, I believe, brought to the Public Safety Home Committee. It's known as the Net Tracker. I believe you've heard me talk about the efforts that we made as a result of the Police Reform Committee between the Sheriff's Department, Greener Pathways, and the Department of Human Services, where we initiated an electronic referral system for instances where a deputy responds to a call and gets on the scene and realizes that the call is more of a indicated for substance abuse intervention or mental health type intervention. So the deputy is able to make an electronic referral from the convenience of the patrol car through the laptop that they have. This is going to be taking that to the next level, this Net Tracker system. It's going to allow for there to be a greater understanding of the various providers involved, or if there aren't additional providers involved, getting those providers involved. So this is kind of taking that referral system to the next level. And then specific to the Department of Human Services, I'd just like to share with you, and I'm very proud of this, that we were audited by the New York State Office of Mental Health. They are the regulatory body for the clinic portion of the Department of Human Services, the Mental Health Center. And we received the a 3-year recertification. That's the longest recertification allowed. So I'm very proud of that. I'm proud of the staff here for obtaining that 3-year certification. In general, the 100% return is going very, very well. No issues there, no complaints. Do appreciate the allowance to have the staff back at 100%. It's going to allow us to operationalize some of the pre-COVID services and increase the number of face-to-face that was being offered previously. And was that it, Kelly? I see you've scrolled down to the last page.
Yeah, that's it.
Okay, in that case.
I don't want to rush everybody, but we've got a 5 o'clock in 10 minutes, so.
You bet.
Sorry.
Okay. So thank you very much. I'll entertain questions if there are any. Otherwise, please feel free to contact me via email or call my office and we can talk more privately.
Thank you, Dan.
Thank you.
Bob?
Thank you, Chairman, and thank you to the rest of the board. I apologize I have to do this by phone, but at this point I've actually transferred into my physician's office and I'm sitting in the waiting area there, so that's why I've done it this way. But I have a couple of resolutions. The first of which is a request to enter an agreement with Northern Rivers for the provision of residential respite services for identifying youth in Columbia County. Essentially, sometimes when we're working with families on preventive cases, and we start to feel a little bit of a breakdown, but nothing so severe where we've got to make a drastic change, we'll use a place to place a child for 2 days or 4 days. The law has it up to 20 days that gets fully reimbursed, and it just gives a chance for a child to go and have a little bit of a cooling off period. We have these agreements with several other agencies, but we always feel the need to have as many as we can.
I'll move it. Adams.
Second, Mushman.
All in favor?
Aye.
Aye.
So carried.
Okay, thanks very much. And the second request comes, which is why I asked Jack to hold on, as part of our meeting of the EMS, it became clear that at the end of June of this year, the quarantine houses that we were using were going to go up for sale. Jack reached out to me and wondered if there was something as far as the rooms that I use to put homeless up in. Would there be a way to arrange something where we could keep them open full time? And could we do it closer than further away from Hudson? So I did connect Jack up with the folks over at Galvin. They do have an agreement that they would keep 2 rooms available, but I think that would require some kind of MOU. So I agreed that I would sort of interject myself in there and somehow, through the 3-way, come up with an MOU so that 2 rooms would be left not used until Jack required their use. And Jack, if you're still on, if you want to, I think I've got that right, but I think that's what the need is.
Yeah, you've got it right. We were using the B&B up in Austerlitz. We had the house in Niverville that we used for quite a while before they wanted to sell that. So we just, the state health department requires we have a isolation facility. This will do the trick for us until they no longer require it.
Do we have any more questions or a motion to approve?
Yeah, I don't understand. Are these 2 rooms not being used for homeless now? Is that what that means?
As I understand it, that they will not be put aside for that purpose and will be held aside for quarantine only until such time as that's not required anymore.
I thought that the homeless situation was the most important. I don't know. It seems very strange to use the homeless shelter, the homeless civic motel, to redefine it and use it as a quarantine space. So I'm opposed to this idea.
Is it usually full out there, Bob? I thought it was.
Go ahead.
Well, I thought that was the priority for the homeless, was out there.
It is the priority for those who fit the program, and for those who don't, we place them elsewhere in the county until such time we feel like they could avail themselves of these services. So we've been probably at a capacity of 16 to 18 rooms out there, and there are 24 in total. So it just happened that there would be 2 rooms. If there's opposition, I'm fine. This is just one way of us trying to solve it, but by no means am I married to the idea. I'm just trying to facilitate at this point.
Well, Bob, if they're not using all the homeless rooms, that's why we're doing that. I mean, it wasn't easy for us to find a COVID house. The reason we're not using the Austerlitz house anymore is because it's on the market. So they stopped the contract with us. So that was a terrific opportunity for us. It's not available anymore. It's not so easy to just find a space. I agree with everybody here that has concerns that we would be taking rooms from homeless, but it sounds like you're not full anyway, and we're not taking rooms from the homeless. Is that correct, Bob?
Well, yeah, that's correct right now. So there's 16 out there, just so that I can be clear. I don't always keep, and sometimes to the chagrin of our provider, I don't always keep it full out there. If by chance the population I have, all of them don't meet the criteria of being ready to receive those services at this time. And that happens to be the case at the moment. We're down to about 16 of the rooms being used. So that leaves 8, which is why there was a thought, well, maybe that makes some sense. If we just keep 2, we're coming into the summer months and maybe that works. But you're quite right. There could come a time when all of a sudden I would need all of those rooms, and then I would have to work with Jack on that and say, listen, I need that. Can you have folks quarantine further out east, maybe in a hotel, and I'll link you up with somebody out there. I mean, it's not a perfect solution, not by any stretch of the imagination. It's just a suggestion that if we had these rooms and we held them, I guess the problem is that any time this need could arise. It could never arise, or it could suddenly arise. So what do you do if it suddenly arises and you don't have anything for sure? I guess that's why this is one idea that's out there.
I would, if I could, like to note that this time of year, whether spring, summer, or even early fall, our homeless population is down. When it rises is usually during the colder months. So, I mean, I don't know what our numbers are now, Bob, but I'm pretty sure that they'll be down.
Yeah, we have 76 in total. Not all of them meet the criteria for the semi-shelter based program that we have, which is why I have not filled the Galvin in over a month, which doesn't mean that wouldn't change. To agree with the other point, it could change, and if that did, I think we'd have to take a look at that. The chances of that are less now that we're into June than they were in March. We'll say that. And again, I'm not sure how long. I know it's an indefinite period, but I'm not anticipating, and Jack, you chime in, we're not looking at a long-term thing as far as your need, are we?
I don't know how long this is going to go on, but we're still doing contact tracing, and as long as we do contact tracing, they require an isolation house. So I really have no idea how long it's going to go on.
Yeah, but this is an isolation house, and this has to be a separate facility. You're mixing 2 groups of people together.
Well, we did that with the Austin.
And all the other ones too, Supervisor Mussman. Then what they did is it was all within the same house. They had 2 things going on. So I understand the concerns. I just know that it was very challenging for us to find something. I think this was a quick fix. Obviously, we can continue to look for something else, but if they're empty anyway, it fills a void and we can continue to look. So at least we have something, because right now we don't have anything at the end of the month. Is that correct, Jack?
Right, as of June 30th.
Right.
I think
Well, all I know is there's a lot of people sleeping in tents in the city of Hudson along the river because they are here, they're in the city. So I'm a little confused about Commissioner Gibson's comment. I mean, it seems to me there's more people without spaces than ever. Just very confused. Galvin Civic Hotel to fill this big need, and the fact that it's not full, I find quite unusually. I find it very peculiar.
Yeah, I could see that from your position. I'll try to explain it. Again, I can't go out into the neighborhood as much as I'd like to do that and start talking with people and bring them in. I can suggest that they do that, but that's how it works. Mostly, it's the need that I'm aware of, that somebody comes into the agency and says, I want to apply for eligibility for this. And that's always been the problem. That's why there's hidden homeless population, because they don't always do that. And even on the suggestion of others, they don't always do that. So you may, I've no doubt that you're seeing that. We see that every summer. And every summer we suggest that people come in and apply, get their eligibility determined. And if that happens, I think there's a chance that you would see that fill up. But if that's confusing to you, it's confused a lot of people over the years. And it was confusing to me until I was where I am.
So I have one quick question, which is, couldn't there be language in an MOU that would state that in the event there was a conflict, or that the first priority would be given to homeless housing? And couldn't we approve this with that caveat and then continue to look for additional housing? So we have most of the bases covered.
The issue would be is if somebody's in the unit, they have to quarantine for 10 days. And if we had somebody that needed it and it filled a room, we would have that gap, obviously. But I mean, I think the committee could definitely look for something else. But I think we can also have show of hands here how we want to proceed. I mean, this will buy us a little bit of time. And in addition, we still have a couple of weeks where we can try to find something else. Go ahead, Supervisor. Morel, did you have something?
I was just going to say that in the past two houses that we've dealt with,
barely used.
We've had to have long-term, they're barely used, but we also had to have longer-term commitments with both of them, whether it be 6 months or a year, where we paid for not having anybody there because the state health department told us that we had to have a house available. So, going forward now, if we, we're probably looking at 6 months to a year when actually this may end in a couple of months or less. But, I'm okay with, I think we need to use this as an interim facility just in case, we do have someone that needs to be quarantined, but I agree we should look for a longer term solution.
Well, and frankly, if I guess we could also take it case by case. So, rather than enter into an MOU, we could take it case by case. There are other hotels in the county that I use. So, at any given time, I should have a room available. I would just have to make all the other operators available. All the other operators in the county, I'd have to advise them that, I may be calling at some point and asking you to set this room aside for this purpose. So there's a number of ways to do this. And I would be happier if somebody had an apartment. Quite frankly, it would take me out of the equation.
But not everybody.
Bob,
we've gone through this. It's not so easy as to call up a motel and say, hey, we want to hold 2 rooms for COVID individuals, potential COVID individuals. We were shut down, time and time again. Not everybody's all that interested in doing this. I think we just have something in front of us. I agree with the group that we need to find something else. But in the meantime, I think we should, at least since we're not using them, hold them, but look diligently for something else. I don't know what other option we're going to have at this point. We could also.
My issue is why aren't we using the Galvan Motel, I guess, and that's another discussion that maybe we'll have some other day. But that is, I'm very surprised to hear that we're not full out there. So that's it. I won't say any more. We're already behind.
So do we want to take a show of hands on this, or if we want to do this, or I mean that would be the democratic way to do it, and then we can obviously with the caveat that we're going to look for something else, but at least we'll have something in the interim because we may
take a roll call vote here, or
I'm sorry.
You want me to take a vote of the?
Yes, I think
Begonia.
I say we do it like I say as an interim with the caveat that we will diligently look to.
We should probably do it in the form of a motion and a second, and then vote.
Okay.
Which I'll make the motion that we do it on an interim basis.
I'll second it, Jerry.
Interim is unclear. What is interim?
Interim would be until we find something more suitable.
Oh, that's not interim. That can be forever.
Okay.
Is it 2 months, 3 months? 1 month? I think you need to put a number on it.
2
How
months.
about we look for something, and then the next committee meeting, we can, because I don't know that we'll find something that easily, and I understand your concerns, Supervisor Mussman. We don't want it to go on for 6 months, but at least that'll give us a place to go, and we'll be in compliance as of July 1. So we could say, if you want, till September 1st. I'm fine with that. Probably by then we could find something.
That makes sense insofar as that it aligns with the capacity that's being given to us by the weather.
Mm-hmm.
Does that work, Linda? 2 months?
I mean, I'm not going to vote for this anyway. You all decide, but I think we need a number on it. I'm opposed to it.
Okay. So let's say September 1st, is part of the motion, and then, so let's put the motion back out there, Supervisor Morel, please.
Yeah, I'll amend my motion to say that, to move this forward with a 2-month interim basis, I guess. That'd be great.
Okay, now you can just roll call vote.
Okay, so Ligonia,
Yes.
Sterling,
Yes.
Adams,
Yes.
Bury,
Yes.
Morel,
Yes.
Mia, Supervisor Mia. Oh, he was on. Okay. Leader,
Yes.
Mussman,
No, for the reasons that it's still unclear to me why the Galvin Civic Motel is not full. So, thank you.
okay. Eldridge.
Yes.
Okay, so the resolution will go through as stated.
Kelly, will they hold the other meeting, or are we running over?
We're holding the other meeting, waiting for this meeting. Because a lot of the people that are on here are going to that meeting.
Thank
So
you.
they're all patiently waiting.
Bob, is there another resolution, or?
That was it.
No, that's
on his.
it on resolution, and I will call Supervisor Mussman tomorrow if she's available. And if it sounds like there's some confusion why the Galvin wouldn't always be full. So, or any other supervisor that has that question.
I have one
happy to-
last comment. Are we paying extra for this? Are we paying Galvin extra for this use of the motel?
This will not come out of the funds. So the funds that I use in the safety net will not pay for this at all. It takes that off of that grid. As I understand it, and Jack, correct me if I'm wrong, you have COVID funds from the state?
Maybe Jack will.
Jack jumped off.
We do
Chairman,
have
do you
money
know-
we do have money that we've paid for the other houses with, so we could use that same pot of money.
Yeah, to be clear, again, this isn't part of the homeless housing program. It was just, okay, yeah, let me see if there's 2 rooms available. So how that gets funded, I don't know.
There's a lot of unclear. There's still many things that I don't understand about all of this. Like,
Supervisor, for a year and a half, we've been using money to pay for housing for COVID quarantine people. We have the funds, and if we don't have the funds, we'll apply for reimbursement from FEMA or the state to get reimbursed.
but that's not my point. My point is that Galvin will then receive an additional amount of money for doing this. That is my point.
That is correct, as if we were to use anybody. It wouldn't matter who we're using. We didn't use the house in Austerlitz, and we paid them for months.
But he's already being paid by us for the use of that motel.
So Bob just said that it would come out of that bucket, that he would no longer be paid out of the DSS bucket or the safety net bucket. It would come out of now the COVID money.
All right, I'm just trying to make these ideas clear. It's a little foggy. So
The only question I have is if you know that there's tents down on Front Street, how do you not know that the Civic Center isn't full?
I'm sorry, say again?
Bob just
I said No, I said to Linda, if you know that there's tents there in Hudson and that there are homeless people down there living in tents in the city of Hudson, how would you not know that weren't rooms available at the Civic Motel?
Well, isn't the key word whether they're eligible for the program or not? Bob has said they haven't been able to meet all the needs because some people don't meet the needs of the program. Am I missing something?
Well, as far as I'm concerned, you're not missing anything. I
Correct.
can't just put anybody there if I've
Exactly.
got children and families out there. If I can be so blunt, because I understand that it would be confusing. I can't mix populations there the way they might get mixed elsewhere because I'm trying to do children and family there. So my main concern when Jack came to me was, are the children and families going to be safe because you're talking about COVID? And he assured me that they would be. And Jack is no longer on the call, so he can't assure me of that. If it's a problem, maybe we can find another hotel to do it at. I mean, I don't want it to be a problem.
Bob, I thank you for that answer. That's what I needed to hear. That's what I needed out there.
We have somebody waiting for another meeting, and there's a lot of people waiting, and all of us have schedules. So if this is a conversation we have to have, we can put it on the agenda for next month and put some extra time to discuss all of that. But I don't think now's the time to do that.
I think that's a good idea, Rob.
I'm sorry?
I think that's a good idea.
So are there any other questions of anything? If not, I would entertain a motion to adjourn this meeting.
I'll make that motion.
Second.
And I'll second it.
All in favor?
Aye.
Opposed? So carried. Kelly, there's another link everybody has to sign on to, correct?
Correct. Yep.
Bye, everybody. Thank you.
Bye.